components that go into the testing, treatment, and tracking of HIV positive Zimbabweans so that we can put an end to this as a health threat by 2030, as is the goal for that. We've made huge progress since 2006. The number of deaths from HIV has fallen 80%, and that is something I think we should all be very proud of. The United States is extremely happy and gratified to support Zimbabwe in this fight through the provision of antiretroviral treatments and the provision of many health workers at a lot of health clinics and hospitals around Zimbabwe. So it was great to see all of that in action today, and to see the dedication and the stubbornness of the healthcare workers who tracked down those HIV positive patients who are scared and reluctant to undertake treatment that can save their lives and those of their families. So thank you to the healthcare workers. You really are heroes in all of this. We are so proud to be part of that. Thank you to the community aid workers for both the children and the adults. People need a lot of psychosocial support when they get a diagnosis like this, and it's just going to take all of us to pitch in to make sure that we prevent the spread of this disease and end it as a public health threat by 2030. So thank you very much for being here today. It was an absolute pleasure to see all of this hard work in action.
And we have such a great person like you coming to the ground to see what really happens. I think you've seen all the hard work that the Zhakata are putting into this. And in terms of the fight against HIV, we've come a long way. And we are really grateful for the support that we get, and we pray we continue getting such support so that we eradicate this disease. So thank you for this presence, and thank you everyone for being part of this meeting.
The doctor and clinical services and medical services. I also offer cervical cancer screening, and also do treatments for cervical cancer. So we have a cohort of 2,666 patients who have their files here, but we also receive several referrals from other facilities within the province. And our staff, we have a medical officer who is a resident. This is myself, seconded by AIDS Foundation. And we have a registered general nurses. There are 8 from the Ministry of Health, and we have 3 OI art nurses seconded by PEPFAR, and 2 VIAT nurses who are also seconded by PEPFAR. We have also primary counselors. There are 3 of them, 2 of which are seconded by Global Fund and 1 is seconded by PEPFAR. The success of this clinic is through the collaboration and partnership of all these different stakeholders to take their part in this clinic. So I will give this time to the sister in charge for the OI clinic who will take you through.
Since 2003, and PEPFAR came not long after that. And so we have been supporting this facility for many, many years now. And it's always so amazing and rewarding to have the opportunity to come and visit and interact with the staff and the client and really see the value of the investments that are being made to support the people of Zimbabwe. And we are really grateful for the collaboration with all the key stakeholders. That is Ministry of Health, and also the district medical office here, as well as the provincial medical director's office, without whom, and all of the other community-based organizations we work with, like Jandiri and our implementing partner Zimtech. And through that strong collaboration, we're able to realize these results.
I'm the executive director for Zimtech, which is a PEPFAR implementing partner. PEPFAR is the Presidential Emergency Plan for AIDS Relief from the United States of America. They're supporting us to support the Ministry of Health towards epidemic control of HIV. We've been supported by this program since 2013, and I think we've made great strides. We are getting very close to epidemic control. Our target is to eliminate HIV as a public health emergency by 2030, and I think we're there. We may even get there before 2030. Our program we support 5 provinces in Zimbabwe: Mash West, Mash Central, Mash East, Mac North and Harare on the care and treatment program. But we have other programs supported by the PEPFAR program which support the whole country. The electronic health record, Impilo, which is supported around the whole country. We have had a lot of support from the Ministry of Health. We've had a lot of support from the community. We've had a lot of support from the other ministries that are supporting. So I think we are on course to reach epidemic control by 2030.
Ambassador, good day to you all. I'm Caroline Kutrai. I'm a primary counselor. I work for Zimtech. I've been with Zimtech for 7 years now. I start work at 7 a.m. and I finish at 5 p.m. So my duties are I offer HIV testing and counseling. When clients come, we first screen them for HIV and test all those who are.
1.5 years, she was still negative, and she is still negative. So that as well.
Okay, thank you. Happy to meet you, my ambassador. Yeah. How is he there? Yeah, Zhakata is my name. 50 years of age.
Okay.
Yeah, the father of